Black toenails are often caused by occupations or activities that we take part in, and it's to do with repetitive trauma. This is either on a very small level of what we call micro-trauma, or it's one incidence of huge trauma. For example, stubbing the toe or dropping something onto it. Following injury, the blood can leak underneath the nail and becomes dry. So ultimately, black toenail is like a bruise underneath the nail. Unfortunately, sometimes in the first instance, the nail can become severely painful because the space and capacity for that blood leakage isn't enough. If that happens, somebody will then have to see a healthcare professional for more invasive treatments. Black toenail is also often known as runner's nail, as it's quite common in the running community and certainly in those who do long distances. When we start to look at prevention, we look at advising people to keep their toenails short, and this prevents the toenail from banging on the inside of the shoe as they run, but it's also about making good footwear choices. As trainers become old, the space within the shoe becomes more and the foot can move, and also making sure that people are appropriately tying their laces. Again, older type trainers can cause the foot to move inside as the laces become weak and slack. Often black toenail will get better on its own, and it's just about being patient because of the long time it takes the nail to grow out. This can be often 9 to 12 months to see a complete clearance of the nail. To minimise the risk of infection, what we would recommend is that people use a sterile dressing over the toe until that nail has dried out.